Hi, I'm Aislinn Antrim from Pharmacy Times. Today I'm speaking with Raj Desai, Director of Pharmacy at Houston Methodist Sugar Land Hospital, about their COVID-19 vaccination efforts, specifically a large event they recently had. So you're located in Texas. Can you just give me an overview of how vaccinations are going in your community?
Definitely. Thanks for having me on this call. It's going fairly well. Last check in mid-March, we had close to 9 million Texans that have received their vaccine doses. In Fort Bend County, which is where Houston Methodist Sugar Land serves, we have close to 600,000 doses that have been given out. Kind of give you a little bit of a global perspective, for Fort Bend County, 30% of our population has been vaccinated with their first dose or more, compared to 20% statewide and 22% nationwide. So as a county, we seem to be doing really well, and even as a city, despite all the supply chain and weather-related challenges. And a big part of this is because of the involvement of health systems, not just of Houston Methodist, but other hospital systems as well throughout the Texas area. Houston Methodist has administered close to 360,000 doses through mid-March, more than 50,000 of which were done here at Houston Methodist Sugar Land.
That's wonderful. You recently hosted a big vaccination event at your campus. Can you give me an overview of that event? How did it go?
Yeah, it's actually in the history of our hospital, one of the biggest events that we had. We had close to 900,000 patients that we were going to vaccinate over a Super Bowl weekend. So it's a very large scale vaccination event, one of the first few in the Houston area. And the reason why is Houston Methodist was selected as one of the few entities to be a vaccine hub. And as part of that, I guess commitment was us using up these vaccines right off the bat versus holding on and doing small events. So it was a big event, like I mentioned, over Super Bowl weekend. We vaccinated close to 9,000 patients. 95% of these patients were 65 years and up. So I feel like we hit the right target of patients back then. And also the other 5% were mostly healthcare workers. So really met the need of what the state mandated back then.
That's wonderful. What was the role of the pharmacy and pharmacists in this event? And what's the role that you're playing in kind of ongoing vaccinations in your health system?
Yeah, so we've been thoroughly involved since day one, since the vaccines arrived here at Houston Methodist. At Sugar Land, they arrived on December 16th. And part of the rollout that hospitals had to do with the vaccines that arrived is vaccinate the healthcare workers in the facility itself. And, due to the nature of our profession of pharmacy, we were really well exposed to what this vaccination event will take. We don't have that many vaccines that require a second dose within a set amount of days. We definitely don't have regular vaccines that require storage requirements that at that point Pfizer did. So we were guiding the hospital operations team on how to plan out the workflow for these employee vaccinations. So for this major event that was happening, it was only natural that they relied on us significantly prior to the event to plan the workflow and also look at clinical considerations such as observation times, adverse effects to be expected. So yeah, big time involvement. I'd say for the event, one of the primary roles that we had was keeping up with the demand, because with 9,000 vaccinations to be done over a weekend, at one point we were doing close to 400 vaccinations an hour. And the struggle we have with that is the expiration date of these vaccines. It's only 6 hours. And if you're not supplying the vaccines on demand, you may risk losing doses through expiration. And that's the last thing you want when we're struggling to get our population vaccinated. Close to only 20% of our population nationwide is vaccinated. So there's several people that are still waiting for more vaccines.
Definitely. You've touched on logistics and obviously those clinical concerns. What are some considerations that others should keep in mind if they're trying to do a similar event? Maybe not that big, but similar vaccination events.
Yeah, several considerations. I think if it's a large scale event, you want to make sure that your workflow is ready. You have the manpower, the resources to handle it. Also, you want to be very data centric. You want to look at how many appointments you have ahead of time. When do you peak in appointments? Because as I mentioned, with the 6-hour expiration, if it's a 12-hour event, you could potentially have half of your doses wasted if you prepare them ahead of time. And if you don't prepare them ahead of time at the right rate, you might have a risk of a lot of patients waiting for their doses. So it's almost you have to think of yourself as a conductor, of an orchestra, and manage the flow of vaccination supplies. And it's only going to become more challenging because what we're seeing a lot of is no-shows and cancellations of patients that may have already received it elsewhere. And as such, you may actually end up with more vaccines made ahead of time. So it is a complex data-driven event. You need folks that are savvy enough to keep up with appointments for that reason.
Switching tracks just a little bit, you experienced a big winter storm about a month ago now. How did that impact vaccinations for your facility and the region?
Yeah, so it had enormous impact nationwide because we were just getting in a groove, around that time where the supply was finally meeting, our weekly demand. We had, close to 8,000 appointments lined up for the whole week as a system. And then all of a sudden, Monday morning, you're hit with this big storm where you yourself are worried about driving to the hospital because we don't have winter storm infrastructure. Our roads were still iced. So you definitely don't want to have elderly patients driving to get their vaccines. So we had to make the difficult call for the first 2 days of the winter storm to back off the vaccination out of safety of the patients. Luckily, we were able to make up a lot of those doses within that week. So those same patients that were disappointed, rightly so, that they weren't able to get their vaccines, were able to get it within that same week. Region-wide, we also saw a lot of impact where, for a whole week, a lot of vaccine centers had to shut down for very similar reasons. But we also had a power outage, which, only amplified the whole issue because we had these Pfizer, Moderna doses that had stringent storage requirements. And all of a sudden, with a power outage, that 6-hour clock of expiration would start with these expiring doses. So luckily, to give you an example, with us, we had a really good backup generator system in our hospital. None of our doses were at risk of expiration. We had Fort Bend County, for example, that lost power and literally had to, in the last minute, send all their 20,000 doses to us, and we helped them in storing most of those doses, and actually got all those doses in the arms of patients. So several issues came up in the winter storm, but luckily, we had a plan with Fort Bend County, a contingency plan either way, if this happens. And I'm so glad we worked on that because it came out to be where we were able to use up all the doses countywide.
That's wonderful. Looking back over the last 3 months of vaccinations, how have you seen supplies change? Has supply increased? Are you expecting more? Kind of what are you thinking there?
Sure, yeah. So I have a very good pulse on supply chain. I've had it since the first day. I'd say the supply is there's still need for improvement in supply, but it's become steady enough where we can predict how many appointments to schedule ahead of time. One of the biggest frustrating things for anybody involved in vaccinations is we can't get it to everybody out there. We have to be very strategic in opening up our appointments. So the position that we're in right now, we're able to predict our schedule ahead of time, set up appointments based on our weekly supply. Back in January, it was really tough because literally we had, elderly patients waiting for such a long time to get their doses, and we were not getting any vaccines. And as such, we almost had to, step back in, adding to our appointments. That isn't the case right now. We're able to, vaccinate the elderly, 65 and up for sure. We're looking for them. And then the moment we know someone that's not vaccinated and they're 65 and up, we're prioritizing them, getting them in. So it's improving big time.
Wonderful. Well, finally, kind of speaking of supplies and scheduling challenges, all of that, how do you anticipate the single shot approach of the Johnson & Johnson vaccine playing into vaccine distribution? Will it help? What do you predict there?
Yeah, another one we had a close eye on to see, when will the EUA get approved, because we really think it's a game changer, and it has so far turned out to be, especially for the traditionally non-compliant patients. A one and done shot strategy is great, and honestly, that's what they want. We had several folks that just wanted to get one shot because of they're scared of needles. So it works out better. It reduces their anxiety by 50% at least. And then also, I think it plays a good niche, in younger populations that, are on the go, that want to get it done and move on to the next thing in life. Also, if you have upcoming travel plans, and you have to go somewhere within a week, it's good because you can get it done at that point and not have to worry about coming back to the original location for the second point, for the second dose. So it plays a very good role. The other thing concerning about J&J is, what I'm seeing is there's a lot of folks that actually have a misconceptions around mRNA-based vaccines like Pfizer and Moderna. And for better or for worse, we are able to give them an alternative that's not mRNA-based. I truly believe that all three vaccines are safe and actually make sense to be given, regardless of preference of brand. But the reality is there are patients out there that have been patiently waiting for J&J vaccine. So yeah, there is a appealing alternative for them as well.
Interesting. Well, thank you so much for speaking with me. This was wonderful.
Thanks. It was great to share my thoughts around all of this.